So quite frequently we talk about cost within our healthcare system in the United States. Now, there are a lot of reasons for that. We get poorer care than other developed nations as well, and they spend much less than us. The reasons for that could be an entire graduate level course. But one of the things that I don't think gets spoken about enough is in this clip on Dr. Mike's podcast with Dr. Sanjay Gupta, who of course is the CNN chief medical correspondent, New York Times bestseller. Let's take a look at this clip.
You alluded to this earlier. To give context, in the UK, they did about 50,000. Now, they're a quarter of our population, but even after you account for population size differences, we still do, 6 times as much as a country like, an area like the UK. Point being that there's probably not great data on the necessity for all those spinal operations. Patients come in, terrible pain, they have a spinal problem. Are we sure that fixing that spinal problem is going to actually help their pain? No. But we tell the patient, look, we're not certain it's going to help, but they're at their wits' end. They want to have something done. I think you sort of see that same thing permeating in the supplement world.
So you're saying like the consumerization.
And so here he talks about something that I feel like we don't talk about enough, in that in the United States, we have this perspective of healthcare where it must fix this, right? You have A, it must be fixed. The honest answer is that in medicine, a lot of times we can't fix things. And so one of the common things is, you might have knee pain or back pain or some kind of musculoskeletal pain or maybe excess weight, and we want to get surgery for that. And that has almost become the standard of care. Is there data for that standard of care? In a lot of cases, there isn't. In a lot of cases, these procedures do help, right? Bariatric surgery does help you lose weight. Getting surgery for certain types of back conditions will make you better. But in other cases, you may not need surgery, right? You may need rehab. You may need a multimodal approach when it comes to medications, physical therapy, lifestyle changes, and modifications. But our system does not reward that. Our system rewards hospitals and clinicians that perform procedures. And I'm not saying that a physician would ever perform a procedure or surgery just for the sole reason of getting monetary benefits of that. But the system in general and as a whole is incentivized for that. And that kind of seeps down into what is an acceptable procedure, what are acceptable items that a patient has to go through before a surgery, how much physical therapy, lifestyle medications, all of that. And so kind of what Dr. Gupta quoted there is when you compare us to other developed nations who actually have better healthcare metrics and results as a whole for their populations, they perform a lot less spinal procedures and other kinds of procedures. And their pushback on that is, hey, they're a universal healthcare system, they are rationing care and whatnot. My kind of pushback to that is look at their lifespan, look at their health span. When you look at that, they are much healthier populations, they tend to live longer, and they spend much, much less. And so I think speaking about money when it comes to healthcare is almost a taboo subject, right? The healthcare system never wants to be painted as a system that does something for revenue. And like I mentioned, no clinician will ever do that, but there's certain incentives where, things will be done to make revenue for the hospital. It may be a patient is having chronic back pain. They've gone through physical therapy. They've gone through, certain medications and steroid injections and whatnot, and a back surgery may be recommended. Now, that could help, but also they could look at the data and say, hey, it's probably not going to help, or maybe it'll be a temporary measure that, alleviates the pain for about 6 months or 8 months, and then the pain comes back. Is that surgery worth it? I'm not the one to answer that question, but I think these are questions and discussions that we should be having. The other thing is, I think as a population, our expectation of the healthcare system also needs to change, right? So I'll see patients who come to the emergency department, they'll say they have, a certain complaint. I will rule out the emergent things that are causing that complaint, right? I'll rule out a heart attack, an aortic dissection, a stroke, whatever the case may be. And I'll say, hey, it's time to follow up with your primary care physician. But a lot of times I'll get that pushback of like, no, I want that answer now. I want an extra test, or I want to be admitted to get this extra test. And, that's not the right answer. A lot of times being admission, you could fall in the hospital and then that leads to complications. You could have an infection that is hospital acquired. That leads to infection. So everything we do has a risk and a benefit to it. And so I think as a population, our expectation of what to expect when we go to an ER or go to a spine specialist or go to a primary care doctor has to be realistic. We need to push back and ask questions, but also it cannot be unrealistic. And so because you have a complaint doesn't mean, X has to be done. Obviously emergent things need to be ruled out. Your pain needs to be treated. Everyone needs to be treated equally. But also, you're not going to get an MRI every time you go to the ER for back pain. You're not going to get a surgery for every ache or pain you have. As we age and develop things like arthritis or autoimmune conditions, there's medications for that. Things can make those better. But the honest truth is that sometimes you will have to live with pain or live with not being how you were at the age of 25 or 20. And so these are, I think, uncomfortable things that we don't talk about enough. And we need to, because we have an aging population. We have a population that is dying sooner and younger than our other developed nation counterparts. And we are spending so much where our country will be bankrupt because of it. Our healthcare system will be bankrupt because of it. And it's just simply not a trajectory that we can both mentally and fiscally afford to continue to head down. So just wanted to share some of these thoughts. I saw this clip and I think Dr. Gupta made a good point, and I think we need to talk about it more publicly about this.